Good evening, everyone, and welcome to the November edition of the X, Mary, and Pat Show. I am Sharonda Lee. I'm a technology assistant and also a certified navigator from Oak Hill Regional Community Development Corporation, the parent organization of Healthy Kids Mississippi. Before we get started, I just want to take a little time just to give a shout out to our amazing team behind the scene that continues to make this possible for us. Our board secretary, Ms. Bettina Campbell, our executive director, Dr. Michael O. Minor, and our beautiful project director, Mrs. Lottie Minor. Just wanted to let you know that we're not just here live on Zoom, we're also streaming tonight's show on both the Healthy Kids Mississippi and the Oak Hill Regional CDC Facebook page and YouTube. So we do ask that you like and share this with all your family and your friends, because others may have questions as well. And we all know that sharing is caring. We do have an app. It's a special app, and it's also a free app that we ask everyone to please go and download. It's in both the Google Play Store as well as the Apple App Store. All you have to do is search Oak Hill Regional CDC or either Mississippi Healthcare Health. And hey, it's going to come up. It's not going to ask you for a dime. And once you download that, don't just keep it to yourself. Share with your friends, your family and friends as well. And we do have some events coming up. We're still doing the Medicare open enrollment. It's still going on. It continues through December 7th. This is the perfect time to make any changes. If you're not receiving Medicare, you may have a loved one or someone that you know that does. So please let them know that it's not too late to make changes. It continues through December 7th. We have our third Wednesday parent resource chat in January, Wednesday, January 15th at 11 o'clock a.m. And we still have our Let's Talk Real Estate with Area Mays, December the 19th at 11 o'clock a.m. as well. The ACA Open Enrollment 2025, it ends Wednesday, January the 15th. That's a big day. Please mark that date, January the 15th. That's when the open enrollment closes. And also for our November health observances, we have pancreatic cancer, National Alzheimer's disease, and also National Caregiver Month. So please keep those in mind. We will remind you again of these announcements at the conclusion of this show. Once again, we encourage you to please download that free app. If you have any questions, please feel free to ask, drop it in the comment section. You can email. We do have a phone number that we're going to give you as well. If you have a question, please ask, and we're going to do our best to answer your question on this show tonight. So that's all that we have right now. So it's up to I'm going to pass it over to you ladies, Miss Mary and Miss Pat.
Good evening, everyone. My name is Mary Fenner. I'm a Medicaid application administrator with Oak Hill Regional Community Development Corporation. I'm also a certified navigator as well.
And I am Ms. Pat Boga with Oak Hill Regional Community Development Corporation. I'm a Medicaid applications administrator and navigator. And we're just glad to be here this evening. We want to thank Sharonda for that fabulous introduction. And I will go ahead with the first question. We do have a question. I applied for Medicaid about 2 months ago, and my children were denied because my income was over the limit. Since then, my income has decreased because I no longer work overtime. Can I reapply now? Okay, the answer to that is yes, you can. You can reapply now, and actually you can apply for Medicaid anytime. But if you want to go ahead and apply now, you can do so. And some of the reasons why you are eligible, well, some of the reasons that you can apply for Medicaid is loss of job, let me see, incomplete, your income decreased, you no longer have any income, or you gained or lost a household member. And these are just a few. Okay, and we have another question. Can I qualify for myself if I cooperate with child support with one of my children's fathers and not the other? The answer to that question is, unfortunately, you will not qualify for Medicaid unless, well, actually, you have to cooperate with child support for both children's fathers. Not just one, but you have to cooperate with both. So the answer is, I don't think you're going to qualify.
Yes, you do have to cooperate with both parents, if they're not in the household with you. Yeah. Okay, so I have a question. I saw flyers with Healthy Kids Mississippi and a sign with Get Covered Mississippi at my child's local Head Start center. Who do I contact about applying for Medicaid or CHIP for my child? The answer is there are sisters, certified navigators at most of the Head Start centers. They can assist you with applying for Medicaid, CHIP, or Affordable Care Act health insurance, or they can refer you to an application administrator assistant to help you complete your Medicaid application, or you can talk with a certified navigator. You can call our office, Oak Hill Regional Community Development Corporation, and our number is 662-298-3584, and ask for one of the sisters. We can complete the application with you over the phone or at your local library by appointment, and submit it to the Medicaid office for you. We also can do the application for you online, which they are now trying to eliminate some of the paper applications and do all of the Medicaid and CHIP applications online. So we can help you with that process as well. And okay.
Okay, and one of the things, we have to get your consent to complete the application, so we can take a verbal consent or written consent. But we are available.
Yes, we are. Both of us has had prior experience with Medicaid office, so we're familiar with some of the rules and regulations that they have. So, and we also have co-workers that are working there now that we can help, consult them for information if necessary. Not personal information, but general questions in case we don't know the answer or some things have been changed.
Yes, and sometimes we may be in a position, or you may be in a position where you don't have transportation and you would rather have a paper application completed. We can do that as well. And of course, we have even driven to the local Medicaid offices and taken the applications there for you. So don't fret. We can still take care of it. We do all we can to help you.
Correct. That is so correct. Our job is to assist you with any of your health insurance needs if we can. Okay, I have another question. My child has turned 19 and is no longer eligible for Medicaid. What are my options? There are a couple options that we have that you can consider. First, you can go to a federally qualified community health center. and you can pay according. They have a sliding scale that you can that they will assist you with, and depending on your income. There, even though it says community health center, they have qualified doctors that are there. So it's more like a medical facility or center. And they do a variety of things. Some of them actually do vision, check your vision. Some of them can even do dental. So whichever one is close to you in your area, we'll look it up for you. We have workers that work with us who has experience with them, and we can contact you and let you know which one is in your area, if that is your preference. But also you can apply for health insurance through the Affordable Care Act. We're a certified navigator, and that's one of the jobs that we also do when it comes to health insurance, is helping you apply for health insurance through the Affordable Care Act. Just give us a call. Again, that number is 662-298-3584.
And, okay,
Go ahead, Pat.
I was just going to say, we're going to be hearing from Mr. Clarence Campbell on the Affordable Care Act health insurance. So he'll be able to help you, give you some more information on that as well.
Okay, Mr. Campbell, are you ready?
Yes, I am ready.
Okay.
All right, I'm sending a request to share the screen. Let's see if it's popped up yet. Okay. Well, again, this is the Pat and Mary Show, and I'm visiting with these ladies again. Name's Clarence Campbell. I am also a navigator with Oak Hill Regional Community Development Corporation. One of the other functions I serve there time to time is the education coordinator. And what I'd like to do is review a little bit more about obtaining health coverage. Some of the information I'm going to share with you, you may have heard already this evening, but I think the repetition is necessary to make sure that you know exactly what numbers to call and what might be eligible for you. So prepare now for the 2025 open enrollment. Open enrollment began November 1st. It's going to run through December 15th if you want coverage to begin on January 1st of next year. But open enrollment will be extended until January 15th for coverage to begin on February 1st. Call 662-298-3584. If you have any questions about what types of coverages might be available for you, this is the number to call, 662-298-3584. Call, and then we'll figure out exactly what type of coverage in talking with you might be eligible for, and then direct you to the correct person that can best meet your needs. Again, go back. You need to sign up by December 15th of this year for coverage to start on January 1, 2025. And I'm going to keep throwing these dates at you to make sure that you remember that you have to sign up by this particular date, December 15th, in order for your coverage to begin on the 1st of next year. There's another number up on this slide too, as well as a website, healthcare.gov. And then their phone number is 800-318-2596. If you don't want to use anybody from Get Covered Mississippi or Healthy Kids Mississippi, you can certainly go to the federal website, healthcare.gov, or you can call their number at 800-318-2596. But of course, we want you to call us. And we want you to call us at 662-298-3584. Okay, so what are your health insurance options if you live in Mississippi and you're under age 65? Okay, the best option is, if it's offered, keep or obtain health insurance from your employer. If you've got an employer that has health coverage available, that's generally going to be the best option. And along with this option, job-related insurance is going to be considered affordable when the employees share the monthly premium for the lowest cost plan offered by their employer is less than 8.39% of their household income in 2024. And so what that means is, if you make around 42,000 a year, 8.39% of that on a monthly basis means that the coverage would have to cost you more than $320 a month, or more than about $160 bi-weekly, in order for this insurance to be considered unaffordable. However, if the insurance is not available through your employer, or if it is considered unaffordable based off of the formula, and if you're unsure about the formula, then certainly call us, 662-298-3584, and we can help you determine whether or not this is going to be affordable or unaffordable, and whether or not you may be able to apply for coverage through the federal health insurance marketplace. So you can go to one of Get Covered Mississippi's walk-in locations. We've got a few of them around, or certainly call us and we'll get you in touch with one of our navigators who can work with you remotely, or possibly meet you person to person at a library or another public place where you can feel safe in meeting us. Okay, in Mississippi, if I'm under 65, what are my health insurance options? So we talked about coverage through the federal health insurance marketplace. But if you do not qualify for coverage through the marketplace, and there's a number of reasons why you may not qualify. You may not qualify because of your income based off of your family size. You may not qualify because of your tax filing status, or a variety of other different reasons. But if you speak with one of our navigators and you find out that you're not eligible for health insurance through the marketplace, or if you can't afford the premiums, there's still some options for you. There's a number of reasons why you may not be able to afford the premiums. First, the premiums, even with what we call the advanced premium tax credit, may be more than what your budget allows. Or it may be that you are eligible to purchase coverage through the federal health insurance marketplace, but you do not qualify for the advanced premium tax credits. And the advanced premium tax credits are subsidies which lower your premiums to what's considered a more affordable amount. You might take a premium of $800 down to $75 or $40, for an example, if you qualify for these tax credits. But again, if you do find out that you don't qualify, then you can contact Healthy Kids Mississippi at this same number, 662-298-3584, to see if you or others in your family qualify for Mississippi Medicaid or the Children's Health Insurance Program, CHIP. And Mrs. Fenner talked about that. You can also go to a Mississippi Federally Qualified Health Center, a federally qualified community health center, if you want to call it that, to obtain coverage there. If you don't know where the nearest one is, you can again call 662-298-3584, and we'll gladly let you know where the health center is that's closest to you. We also have individuals that work with us, which can kind of make it a little bit easier for you to actually get your care taken provided there. Can kind of smooth the road for you a little bit. All right, so let's talk a little bit about what's covered with marketplace insurance. Essentially, it's going to be the 10 essential health benefits. That's the first thing that's covered. And these are the 10 marketplace health benefits, the 10 essential health benefits. And these are, number one, ambulatory patient services, outpatient care you get without being admitted to a hospital, emergency services. Then there's hospitalization like surgery and overnight stays. There's pregnancy and newborn care both before and after birth. Mental health and substance use disorder services, including behavioral health treatment, counseling and psychotherapy, prescription drugs, services like physical therapy, occupational therapy and speech therapy, laboratory services, preventive and wellness services, and chronic disease management, pediatric services, including oral and vision care, but this does not include adult dental or vision coverage. Now, there are plans available here in the state of Mississippi by some of the providers that have the option where you can purchase a plan that will include dental and vision coverage. Then also you can oftentimes be able to purchase what's known as a standalone dental plan. What is also included in marketplace plans are preventive care benefits for adults. There are 22 that are listed here. 22 is a lot for me to read, but I'll read through some of them. It's like blood pressure screening, cholesterol screening, colorectal cancer screening, depression screening. The first one was abdominal aortic aneurysm one-time screening for men. And I got something on my screen covering this up, so I can't. Oh, for men of specified ages who have ever smoked, as well as alcohol misuse screening and counseling. There's fall prevention and exercise, diet counseling. There's hepatitis B and C screening. There's HIV screening, as well as screening for other sexually transmitted diseases. There's PrEP, pre-exposure prophylaxis, HIV prevention medication, immunizations for adults. The doses, the recommended ages, and recommended populations vary, but there's about 14 or 15 different immunizations that are provided. There's lung cancer screening, there's obesity screening and counseling, tobacco use screening for all adults, and smoking cessation programs for tobacco users, and tuberculosis screening. And so all of these preventive care benefits are available to you at no cost or very little cost at best. And these are available before any deductibles are paid. And so some fast facts. Again, open enrollment began November 1st. It runs through January 15th of next year. For coverage to start on January 1, you must pick a plan by midnight on December 15th. For coverage to begin on February 1, this would be if you enroll after December 15th of this year and up until January 15th of next year. After January 15th next year, 2025, you can only enroll and or change plans if you qualify for a special enrollment period. And if you have any questions about any of this information, what number do you call? 662-298-3584. Any other questions that we can handle for you this evening? Okay, well, that would be about all that I have at this time. So I'll get out of this program. Stop sharing and turn you back over to our facilitator, Miss Lee.
You're muted.
Miss Lee, you're muted.
I'm so sorry. Thank
That's
you so
okay.
much, Brother Campbell. Thank you, Mr. Campbell. Great information that was shared with us on this evening. Miss Mary, Miss Pat, y'all have anything else?
Yes, we have a few more questions for
Okay.
you. Okay. We're on number 4.
Okay, let me
Oh,
see.
3. Number 3.
Number 3.
Mm-hmm.
Okay. This question, a Medicaid assister helped me with applying for Medicaid for my family, and it was submitted online. What do I do next? Okay, what you'll need to do is you will now have to wait until your Medicaid worker processes the application for approval or denial. And they will send you a letter showing your approval or denial, hopefully approval. They have actually 30 days to process your application. And it is possible that the worker can process the application sooner, but they do have a 30-day processing period. So, sometimes I know there are some emergencies, but there is a 30-day processing period. Make sure also that you have sent in your income verifications or pay stubs that are needed if you're employed. But that's all you have to do.
And sometimes they may request additional information other than the income. So whenever they're going to send you a letter in the mail and contact you, let you know that they need additional information. And you have a time period in order to send that information in. So just look out for your mail. And if additional information is required, please send it to them timely. Okay. I recently took my child to the doctor and they told me that the doctor's office that the Medicaid was not active. I don't know what could have happened. I did move to another address some months ago and did not report it. So it is very possible that you miss your Medicaid renewal letter or appointment. You have to report an address change to Medicaid and a new contact phone number if you have. The letter will not be forwarded to your new address like other mail. The mail will go back to the Medicaid office and you will lose coverage if they have not received a response in time. A Medicaid application administrator or sister with Oak Hill Regional CDC can assist you with completing a new Medicaid application with your correct or your new address with your consent. Just give us a call. And I know you've heard this number, but it's 662-298-3584. You can contact us for any additional information or help with reapplying for Medicaid. And you can reapply at any time, even if you get denied. And like she was saying earlier, as far as your income change, if you were denied because you were over the income, you can always reapply. There's no period, processing period, anything like that. You can reapply at any time.
And I just received a text from a consumer stating that, well, they're actually waiting on their approval. And I explained to them again that there is a 30-day processing period. And so they will get to it as soon as possible, but I encourage her to reach out to Medicaid again when she gets a chance, because she said she received a letter asking if she wanted to register to vote. But I just encouraged her to reach out to a worker, and hopefully they'll get her, approved very soon. I think we have one more question. Do you all charge for helping a person with completing a Medicaid application in person or online? Okay. No. Oak Hill Regional Community Development Corporation is a nonprofit organization, and we cannot charge a fee for assisting consumers. We cannot accept gifts, discounts, or any other incentives from consumers for the services we provide. We're a faith-based organization, and our goal and mission is to get you covered.
That is our goal, and that is our mission, is to help as many people as we can in the state of Mississippi. We have sisters all over the whole entire state of Mississippi. So if you in another area other than North Mississippi, there's somebody in that area that can help you as well.
So we have someone in the Delta, South Mississippi,
On the coast.
yes, on the coast. So it's no excuse. We are here.
We are here. Right.
Any other questions? Okay, let's see one in the chat. Okay, can you get that one, Sister Fenner? Mrs. Fenner?
Okay, the question is, if I am really sick and need medical attention while I'm waiting to be approved, is there anything I can do? Yes, you can. They're the federally qualified health centers that you can go to and receive services from them if you don't necessarily feel like you're sick enough to go to the emergency room or urgent care. The federally qualified health centers are there for you. They have a sliding scale that charge you according to your income. So please, 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 if you are sick, if you are really sick, you can go there and can be seen. And also, another question is, can the ER refuse to help me? No, the ER cannot. If they cannot refuse anyone, even if you're waiting you have a pending Medicaid application, it doesn't matter. They will bill you. And then once your Medicaid gets approved, if it gets approved, you can contact them with your Medicaid ID number and they will bill Medicaid for you. So the ER cannot refuse you. If you are sick enough to go to the ER, please go.
Right.
Don't wait because you don't have any insurance. Please go.
And they also they have charity programs that can assist you as well.
They do. They do. They really do. And it's available and they will let you know. especially if they know that you do not have any health insurance. They will let you know about the charity programs that are available. That was a great question. I do not see any more questions.
Do we have any on social media?
Okay, if there are not any more questions, we're going to turn it over to Miss Sharonda Lee.
Thank you, ladies. Thank you. Great questions, great answers. Again, anytime you have questions, please feel free to ask us. And you've heard this number several times tonight, but we're gonna say it one more time. You can contact our office at 662-298-3584, or either you can text us at 662-689-9712. And if you would like to learn more about us and what we do, please go visit our website, www.oakhillregionalcdc.com, and also www.healthykidsmississippi.org. As we conclude, we do want to acknowledge our board once again because they make this all possible. Our board secretary, Ms. Patina Campbell, our executive director, Dr. Michael O. Minor, and our beautiful project director, Mrs. Lottie Minor. This has been a proud production of Oak Hill Regional Community Development Corporation, where we are dedicated to belonging, building, and bridging in the Mid-South region. Thank you all for joining us. Please remember to share and tell somebody else about us. Enjoy and happy Thanksgiving.